all, changing a behavior is a very tough challenge when it relies on just going to see someone to tell you what to do, or the other side of the scale, just follow a digital app. That makes a big opportunity on the product. So delivering something that is tangible, that utilizes virtual reality, that is an innovative technology that drives interest, but also the core of the technology and the frameworks using mindfulness and psychotherapy makes it in a way very easy for a user to become aware and have resources to overcome their challenges. Hi, I'm Nicolas Rosencovich. I'm the CEO and co-founder of MindCo Health, a company where we are revolutionizing behavioral health using virtual reality to help millions of people. And why we're doing this? Because even more today, we are aware of the crisis in mental health, and employers and insurers are addressing it internally. They are demanding solutions to go beyond what is available in health systems. So the problem of it is that most of solutions available standard of care rely on one-on-one format on therapists, and the problem is the shortage of those therapists. So adding a layer to that is my personal journey. I struggle with behavioral challenges as an early adolescent with alcoholism. I almost died because of it. And my challenge was double due to stigma and lack of solutions available. So that's why we developed the MindCo platform, which is the first accessible, affordable, and scalable solution that evolves the one-on-one therapy format into an accessible cognitive immersive training platform. We can train the brain and body of each individual completely at home through a series of real-life simulated scenarios that get the user to learn how to react and change their unhealthy behaviors. Why VR? Because over the last 25 years, there's been tremendous and good research that shows the amazing outcomes that it can achieve with this versus standard of care. And there are very good examples of companies doing this work in mental health with VR in the market. However, all of them are working within the clinical setting. We are going beyond that. We are going beyond the barriers of health systems, and we're delivering this at home. But we proved it. We conducted our clinical trials, co-authored with Johns Hopkins researchers, that shows outcomes that are threefold better than standard of care. And the beauty is not just that. The beauty is that this technology can be applied to the whole behavioral health spectrum. We started with smoking cessation, and we have recently introduced a new product for stress management into the market, demanded by the employers and brokers that we're working with. So talking about it, the market is huge and will continue to grow, and even more with the awareness today in mental health. However, understanding that there are new channels to distribute this, our solution fits perfectly well to become leaders in the market of corporate wellness and insurance brokers. And that's where we make it very easy. We offer a subscription model that fits perfectly well within the price and models of health and life insurance as a feature. We're bundled together and sold directly to employers or through distribution partners as broker insurance. Over the last 12 months, we closed agreements with the top 4 global insurance brokers in the space. We are today serving 11 countries and have an opportunity to address 120 million lives in the coming years. This opportunity gets us into a trajectory of a healthy and exponential growing business to serve more people with what we have today in our pipeline and what is coming up in the coming quarters. The reality of this is that we are there today. We are 200K in revenue from the last 12 months. We're serving 13 different B2B customers. We are serving more than 14,000 lives and signed up with 6 different insurance brokers to distribute this massively. Why brokers and employers are choosing us? Because we outstand versus everything that is out there in the market. Our numbers are over the roof in this funnel when people use it, when people stay and achieve outcomes that impacts on return of investment, on health outcomes, and so on. We are an exceptional executioner teams, experts in the fields of neuroscience, psychology, and virtual reality. And we are guided by the leaders in the academia and the industry to push the boundaries of this format of evolving the therapies. what we're doing today is that I'm inviting you, all of you, to participate in this round or to approach with business, because we are delivering the contracts that we have signed and we're growing. So we're raising a 3 million seed round to become the best experience and solution for our users, employers, and brokers, so they can stop talk about us and how our program is helping them to achieve their results. Thank you very much. Open to your questions.
Thank you, Nicolas. That is incredible that your outcomes are 3 times that of the standard of care. What do you attribute that to?
So what we identified beyond just research is that making tangible something that has been usually digitalized and reducing the capacity of getting someone to be enrolled, changing a behavior is a very tough challenge when it relies on just going to see someone to tell you what to do, or the other side of the scale, just follow a digital app. That makes a big opportunity on the product. So delivering something that is tangible, that utilizes virtual reality, that is an innovative technology that drives interest, but also the core of the technology and the frameworks using mindfulness and psychotherapy makes it in a way very easy for a user to become aware and have resources to overcome their challenges.
So digital therapeutics and telemedicine are obviously playing a big role in mental health solutions right now. Why, in your view, are those types of solutions not enough to make an impact?
You mentioned something amazing, and we are all glad with virtual care and what the pandemic brought into this going beyond health systems, but this is not enough. Scaling practitioners, scaling people on the other side of the camera has a very high cost, and it's almost impossible due to the nature of how many are they. So when it comes to getting solutions in the hands of underserved populations, more users to be able to have a first approach to a behavioral health solution, you cannot start with a telehealth virtual care platform because it has not started even now. It's still growing, but it still lacks from the nature of having to put someone down the line to help you with. And we're not saying that it's bad. We're saying that we are the first response to behavioral health, and then we can refer from here, but achieve better outcomes and help more people with these kind of approaches.
And a couple of questions in the Q&A, and just quickly, because we're almost out of time. One, can you walk through a specific use case to help the listeners better understand the product?
So you are an employee of a company and you are offered through an enrollment program that now you are into the MindCo benefit. So you can either choose from the programs available, and we offer an assessment, behavioral assessment protocol. So every user answer a couple of questions. If they are opt for the program, they fill in their data, their shipping information, and we take it from there. As a user, you will get a kit delivered to your home and an onboarding session with a coach and very easy steps to do every day on how to change your behavior through a series of different content, virtual reality videos, mindfulness interventions, and so on. From a company perspective, you're getting aggregated reports on how your company or your group is performing on your on the funnel, on adoption, on utilization and outcomes, and how that correlates with health-related cost.